Because there's a connection of feeling like in talking about death, you're bringing it. Or in leaving the traditional hospital setting that you've given up and you're no longer taking care of your loved one. And there's like such deep connection to family and community that this idea of like that you could get blamed for what is happening to your loved one, like that was really hard to navigate.
You never truly know people until you take the time out to get to know people. I am loving this conversation with Juli. So many different nuggets of value to take for different phases and stages that you are in life. As a leader, as a mother, as a parent, as a friend, as a sibling, in different situations. So where we are at right now, Kimbilio has been built, living room. That's the one that we visited. That was built. That's now you've got the land, and now you begin the construction of that. Okay, what is that space?
So
at that time when it's built,
before it was built, it's just a flat land, dirt, that we were able to purchase from one of our neighbors, and then to construct a 26-bed hospice, which we've mentioned this before, but the concept of hospice was somewhat of a unknown within the area. And so David Tyrus really became the voice for giving meaning to what it was and would become. Because even, like we said yesterday, like traditionally hospice in the US or in the West is end-of-life care. But what we were trying to do was provide care for people living with HIV initially, with the hope that they would get better. So while it might be a place for them to come and experience their last days, like many would get better and go to the community. So that's how it was created. Adults, children, in partnership with AMPATH, which is the HIV treatment centers. That's who was referring patients to us. And it started really kind of local and then grew as the reputation of it went into the community and to different hospitals. So people started coming from all over the country to receive care.
And now, of course, when you started in the community, even people, because there was no health facility in that space.
So there was close, not too far, there was an outpatient clinic for like moms to come and deliver, or for vaccines for babies, or if you had an accident or something to be able to come and receive treatment. So there was a small clinic for that had been established, but there was nothing like this in the area.
So now, of course, if people would start getting sick, to them, they'd also look at this as an option to come.
Yeah, so we had to begin, like especially early on, just create a context for what it was and communicate that to the community. But so many people within the community, their relatives may not be from right there, but from somewhere, they would call and say, I have this patient, this relative, this brother, like, is there space? And so Daniel Morogo, who is our patient care coordinator and has worked with us since 2010, he's really the heart, like I see him as the heart of our work, because he carries this little phone that,
like a Bambi,
that the battery never dies. And there's people from all over will get the number for that and call him and ask if they'll call and say, we need help and can we come? And so he's the one who helps to direct. And the way that over the years, like he's a social worker, but had no background in hospice or palliative care services. And he would say, like, I wasn't sure what we were doing. But the way he has ownership over it all now, it's incredible.
I can imagine, even if you were to introduce this space in Nairobi, at the time when you were doing it, it was still so foreign. And that's within the urban city. Now, what more? People know of homes where the elderly go. But this isn't that, this wasn't that, this is a hospice. So I can imagine you then introducing that concept in a land where people don't like talking about death, where it's taboo to talk about death, even though it's happening to people.
Because there's a connection of feeling like in talking about death, you're bringing it. Or in leaving the traditional hospital setting that you've given up and you're no longer taking care of your loved one. And there's like such deep connection to family and community that this idea of like that you could get blamed for what is happening to your loved one, like that was really hard to navigate.
So just to fast forward till today, what's the response from the community of the place now?
I would say generally, and like it's very well respected and received, and even when someone might say, well, that's a place where people go to die, like in some ways that's true. It's a place where we care for very, very, very sick people and welcome them and want there to be dignity for them and their loved ones as they pass away from this world. And so to not apologize that that's the work that we do, but also to not feel like that's a failure, to believe like that there's an opportunity and that we have to care for this population.
And what about now the governor in terms of, or the government, the county government getting involved in accepting this? What do they do?
Yeah, we've had really good support from the Wasangishu County, their government, the governor. The first governor came multiple times to Kimbilio. He brought the county staff to come and see like the cleanliness of the place, eventually helped to fund a bridge that's just near our property so that it adjoins two communities and allows people an easier access to the hospice. There's been different times where there's been funding for a nurse or different people to allow us to continue to do the care that we provide.
Okay, so you set up this Kimbilio. Another thing that I liked was still the community element. And when we started the tour, like we're showing people right now, water is life. So not just creating a space and isolating it and telling people to come in, but then also opening up.
So I think one of the things that sometimes organizations can do is they can feel like wherever they're located, that's their own space, and let's just build something of quality within our gates and within our fence. And David Tarous's vision and leadership is actually we're in the middle of a neighborhood. So what does it look like for us to pay attention to our neighbors and to be good neighbors? So, rather than like, how can we not have competition around us? It's like, actually, how can we collaborate with those around us? How can we partner and really serve the community and also receive from the community? So that's always been like very core value. So when we dug a borehole, we had a lot of water. We have a solar pump and we were getting 5,000 liters an hour of clean water. Beautiful. And so obviously we needed some water for the hospice, but also it's like we're in a neighborhood that doesn't have clean water. So why wouldn't we put a tap to the community so that they could also benefit from the resource that now we had?
For free.
Yeah.
And have you felt the impact of that? Are people being grateful?
Well, I don't even think that's like, grateful is on them.
Yes.
For us, it's are there less waterborne illnesses? How's their quality of life different because
We came to the space.
gave? You know, like, so, I mean, I think the response is gratitude, but I think for us, it's still like, what is the value of what we're
I get it.
trying to share?
Hey, Julie, you're different. I love your posture. Okay, so continue with the story, and I'm just trying to find out, is shortly after when now the funeral home comes, and if it's not, we just continue with the story from where it goes.
So it is. Like, we opened the hospice in 2011. What we began to realize very early on is that if someone passed away, that there were no mortuary services between where we were and 50 kilometers to Eldoret town. So we needed to be able to have a place to be able to store the bodies until the loved ones could come, and because burials are done often within the community at the homes of people. And so David Tarus began to meet with community leaders, neighbors, and just explained, like, this is what we're thinking to do. We would want to also offer it to the larger community versus just who might die at the hospice. And so with time, like, the community in those meetings said, yes, we would like to have it within the community. And so we were able to build a funeral home. The hospice, as I mentioned earlier, is largely a free service or lower cost, like definitely subsidized. But the funeral home was a service that we felt, because it's a one-time expense, and because Harambes, they happen, and it's easier to fundraise for a one-time expense than ongoing health care. That it's something we could charge, and that any profits from that would come back to the hospice to be able to take care of patients.
Okay.
So that's what we began to do.
That's sharp. You got a commercial entity to help this other situation. And let me
That's still in line with our mission and is allowing us to serve the families of those we've either cared for or those from our community and larger area.
And okay, so 2011. Okay, I've gotten there. I'm with you.
So we're in 2012. I don't know if you want me to talk about Titus now or later, but I married Titus in 2012.
Don't skip.
So at the end of 2011 is when I met who would become my husband.
At the end of 2011.
And I married him in 2012.